Good morning, everybody, and welcome to our Health to Hold. It's 2024. I cannot believe it, but we continue to do this webinar series. And for those of you who are new, my name is Jenna Sistad, and I'm with the Ocean Monmouth Health Alliance, our region's cancer and chronic disease prevention coalition. We've been doing this series since the inception of COVID, and it's proven to be worthwhile. And we love to highlight the work of our community coalition partners. And so we continue to do that and add a little component of education about whatever Community Health Awareness Month is going on. So for this particular month, we have our cervical cancer awareness campaigns happening. And for that, alongside of this webinar series, we have our friends at Planned Parenthood here to talk with us today about what they have going on at their organization and to provide some education about women's health and cervical services. So I'm going to turn it over to Josie and also to Kathy so that they can share a little bit more. Thank you both for being here with us, and for everybody else who's joining, thank you as well.
Thank you, Jenna. So like you said, we're going to be talking about Cervical Cancer Awareness Month today. I'm Josie. I'm a sexual health educator. I'm also a COVID educator, and I am our teen conference co-chair, and I'm going to be joined by Kathy. If you want to introduce yourself.
Absolutely. Hi, everyone. Good morning. My name is Kathy Obando. I'm a nurse practitioner here at Planned Parenthood of Northern, Central, and Southern New Jersey. I'm based primarily at the Perth Amboy and Elizabeth and Shrewsbury offices. And I'm happy to be able to join you today to talk about cervical cancer.
Thank you, Kathy. Okay, so before we get started talking about cervical cancer, I want to talk to you about Planned Parenthood in general. So just a list of our services. We have annual exams, cancer screenings, birth control, emergency contraception, STI testing and treatment. We have this awesome program called GYT, Get Yourself Tested, which means you can come into any health center and say, hi, I'd like to get myself tested. And we will test people for syphilis, HIV, chlamydia, and gonorrhea. And that's completely free. You don't need insurance to get that testing. We have pregnancy testing and education. We have abortion services. We have the HPV vaccine. We have PrEP and PEP. We have an awesome PrEP counselor named Bree. So people who want to get in contact with her, we can put her contact in the chat if people are interested. We do offsite services, meaning we will do HIV testing, syphilis testing out in the communities as needed. We have health insurance assisters, so people who will help people to get on Medicaid or marketplace insurance. And then we also have sexual health education, which is what I do. So going into different schools and communities to provide sexual health education. So these are some of our locations within our affiliate specifically. So the closest health center to you all is probably Shrewsbury, but anyone can go to any health center that they want to. Some people choose to go to a health center that is within their community, within their town. Other people, prefer to go to a different health center because of, certain clinicians that they want to see and things like that. And we're completely flexible. You can go to any health center that you want. All the staff is great, regardless of which health center you go to. If you want to make an appointment with us, there are 3 different ways you can do that. So you can call our number, you can go onto our website to make an appointment, and you can also go into a Planned Parenthood to make an appointment. So, a lot of people are a little bit nervous about making their first appointment, especially, post the pandemic. I know that COVID is still on the rise, but a lot of people are nervous, making those initial appointments. So you can go into a health center and you can just talk to someone. What is that process like, and have it, demystified a little bit before you actually have to have your appointment. So whichever method works for you, we are here for you. So definitely make an appointment if you are in need of any of our services. All right, I'm going to pass it over to Kathy.
Okay, thank you so much, Josie. So what is cervical cancer? How about let's first take a step back and talk about what is the cervix. The cervix is the bottom portion of the uterus that connects the uterine cavity or the womb to the vagina or the birth canal. There are 2 different types of cells that cover the cervix. The first type of cell is called squamous, and these are the cells that line the part of the cervix that can be seen during the gynecological exam. The second type of cell is called glandular, and these cells line the cervical canal that leads into the uterus. The place where these two cell types meet is called the transformation zone. And the transformation zone, it's this transformation zone that most cervical cancers originate. Cervical cancer is a slow-growing cancer that does not typically result from sudden changes in either of those two cells. There are precancerous changes that develop over time, and it is this persistence of these changes that can lead to cervical cancer if no treatment is sought. Worldwide, cervical cancer is the third most commonly diagnosed cancer, and is the fourth leading cause of cancer death in people with uteruses. Thankfully, here in the United States, there has been a dramatic drop in the cervical cancer mortality due to widespread screening with pap smears. So, how does someone get cervical cancer? Research has shown that cervical cancer is a result of the human papilloma virus infection. HPV is a common virus that is transmitted through sexual activity, whether that's by oral, vaginal, or anal contact. HPV is the most common sexually transmitted infection in the United States. Approximately 75 to 80% of sexually active Americans will be infected at some point within their life. The good news is that the vast majority of people will clear the virus via their natural immune system within 2 years of infections. There are hundreds of types of HPV, but only about 14 of these are considered high risk for development of cervical cancer. In addition to HPV infection, other factors can influence the development of cervical cancer, which include cigarette and tobacco use, infection from other bacteria, certain vitamin deficiencies, and a suppressed immune system. How does tobacco use increase your risk of developing cervical cancer? Well, smoking impairs the body's natural immune response, and it impairs the body's natural ability to clear the HPV infection. Infections with other STIs like chlamydia, gonorrhea, or trichomoniasis cause chronic inflammation, and this chronic inflammation increases one's risk for susceptibility to HPV infection. Now, this is one I just learned doing research for this webinar. Vitamin A, folic acid, and beta-carotene deficiencies have also been associated with an increased risk of cervical cancer. Lastly, people with suppressed immune systems. Now, it could be, you could have a suppressed immune system due to taking medications to prevent organ rejection, like for transplant patients, people who use medications to suppress their immune system with autoimmune diseases, like rheumatoid arthritis, for an example, or people who are on HIV positive patients who are on medications for their HIV that also suppresses their immune system. And the reason why these people are at higher risk of possible developing cervical cancer is because this compromised immune system, this suppressed immune system, cannot clear the HPV infection like someone with a healthy immune system would. So what are some symptoms of cervical cancer? Unfortunately, early stage cervical cancer is most often asymptomatic, which means no symptoms at all, which is why this cancer can easily progress undetected. That is why screening is so important. The most common presenting symptom, when one exists is abnormal vaginal bleeding that can be heavy and or abnormal or irregular. Advanced stage disease can present with lower back pain or pelvic pain that shoots down the back of the legs. And I just wanted to take this moment and stress that, again, most time there's no symptoms for cervical cancer. So that is why screening is so important. So how do we diagnose cervical cancer? Let's talk about pap smears. The pap smear test has been used as an effective screening test to identify abnormalities in cervical cells since the 1940s. A pap smear is a relatively quick and typically minimally invasive exam performed by a primary care practitioner or reproductive and sexual health practitioners. This test involves inserting a speculum, which is this little thing that we have here. Most offices have them either in metal or in plastic. So we insert that speculum into the vaginal canal to allow adequate view of the cervix. Then, after the cervix is inspected for any abnormalities or growths, cells are gently scraped off the cervix, the outermost portion of the cervix, using this kind of little spatula looking brush thing. We just scrape the surface of the cervix like that. And then a small brush, like this mascara looking brush thing, is inserted through the external os. The external os is the opening into the cervix. And so we just swirl that little brush there to collect samples from the endocervical canal. Then these cells are sent to the lab for a pathologist to examine and evaluate and determine if there are any atypical or abnormal cells present. As clinicians, we follow guidelines. There are guidelines that help to assess when people with uteruses should start pap smear screenings for cervical cancer. These guidelines have rapidly evolved and will continue to change as the science and understanding of HPV and cervical cancer develop. Even though most people with uteruses in their 20s will be infected with HPV, their immune systems will clear the virus on their own. Because of this, teenagers and those under the age of 21 are not required to get annual pap smears, regardless of sexual activity. Starting at age 21, people with uteruses should get their first pap smear. If results are negative or normal, they can continue with routine screening pap tests every 3 years. HPV testing is not recommended for ages 21 to 29. And people 30 years and older should get a combination or co-test pap smear. This combination test is the pap smear and the HPV high-risk DNA testing. People older than 65 years old no longer require a pap smear or HPV testing, as long as they do not have a history of abnormal pap smears. People with a history of cervical cancer that have received appropriate and adequate treatment should continue pap and HPV testing for about 20 years past their date of their initial diagnosis. No further screening is needed in people without a history of cervical cancer or dysplasia who have undergone a total hysterectomy, which is the removal of the uterus and cervix, like for those that get hysterectomies for fibroids or things like that. I just wanted to make a note that routine pap smears are still recommended even if you have received the HPV vaccine. So make sure to get a screening pap smear test starting at age 21. And if normal, those routine pap smears are done every 3 years. Then again, just reviewing our protocol here. Starting at age 30, screening pap smears will include their HPV DNA testing for high-risk HPV. And like I said, and if they're normal, you can do routine screenings every 3 to 5 years. However, if you do indeed have an abnormal pap, you will need more frequent pap testing and a special test like a colposcopy. A colposcopy is an office procedure in which the cervix is examined by a clinician using a special magnifying instrument, and then small biopsies, which are small samples of tissue, may be taken if the abnormalities are seen. The biopsies are then sent to the lab for evaluation by a pathologist. If this colposcopy comes back abnormal, you may need further testing or a more in-depth biopsy to determine the extent of dysplasia. So how can we prevent cervical cancer? We're going to be talking about the Gardasil. Have you heard of Gardasil 9? Because HPV is a sexually transmitted infection, we recommend preventing it in similar ways that we recommend preventing all STIs. So you want to make sure you are practicing safe sex, meaning you are using condoms and dental dams consistently and correctly every single time you have sex. Another way to prevent cervical cancer and prevent spreading HPV to a partner is to follow our guidelines around pap smears and HPV tests. Lastly, getting to the HPV vaccine, and we got a whole more on the next slide. So the HPV vaccine, or Gardasil 9, protects against 9 strains of the human papillomavirus, including HPV strains 6, 11, 16, and 18. HPV 6 and 11 are responsible for about 90% of all genital warts. And HPV 16 and 18 are responsible for about 70% of all cervical cancers and about 80% of all anal cancers. Ideally, the Gardasil vaccine should be given before the onset of sexual activity, which is why it is included in most adolescents' vaccine schedules. The vaccine is approved for men and women up to age 46 years old. When given before exposure, HPV vaccine is effective in preventing cervical cancer and pre-cancer, genital warts, anal cancer, and throat cancer. This vaccine is very safe. However, if you have an allergy to any of its ingredients, do not get the vaccine. If you have a fever of 100 degrees Fahrenheit or more, you should wait to get vaccinated. The vaccine is given as a series of 3 injections within a 6-month period. Usually, the most common side effect of the vaccine is, like most vaccines or injections, is swelling and tenderness at the injection site. I did want to remind you that even if you do get the HPV vaccine, remember, you still need your preventative screening pap smears. And even if you have a history of abnormal pap smear, there may still be some benefits that you can get if you get the vaccine.
Kathy, thank you so much for explaining all of that. I feel like you do such a good job. So I just really appreciate it. I'm now gonna tell you a little bit about like accessibility in terms of the HPV vaccine. So just so you all know, for all Planned Parenthood services, regardless of what service it is, we have a policy called a care no matter what policy, meaning we do, we charge for services, we take insurance, but if someone comes in and is like, I really need this service done, and they don't have insurance, they don't have the money to cover the service, we will help them. So even if for instance, the cost is $400 and they have $100 to give, we will just take that $100, and we're not going to hunt someone down for the rest of that money. That's not what we do. We're not in that kind of business. We just allow people to pay what they can. So, that extends to the HPV vaccine. And we have this really great HPV vaccine program based on, donors within the community donating money specifically so that people can get the HPV vaccine. So the way that it works is that someone has to come in and pay for the initial visit, but then the first shot is covered, and then the third shot. The first shot is covered, and then the third shot is covered. So, this really helps to reduce, the burden of costs for anyone who wants to get the HPV vaccine. And again, like I said, we will work with anyone who wants to get this service done, and any of our services in general. So thinking about accessibility, like I said, it's really important that people do get this vaccine, and costs and ability to have insurance should not prevent anyone from getting the HPV vaccine. We will work with you, call our health centers, allow us to walk you through that process, and use the funding that we have to help cover some of those costs. These donations are specifically for people without insurance. So, this is a great program for people to use and helps to make it more accessible. So that's it from us. We can move on to questions. Thank you so much.
Thank you, Josie and Kathy. Great presentation. This was a wonderful way to kick us off in January. You gave a comprehensive overview of what you guys have to offer, as well as a fantastic educational piece about the cervical cancer, as well as HPV. So thank you for that. I did write down a question, and you answered most of it, but when we talk about that second shot, I know you said the first and the third shot are covered for your HPV donations. What does a typical second shot cost if they were interested in getting the whole series?
Kathy, do you know the answer to that? I'm actually not sure how much.
I actually do not, but I can pop out later on and ask one of the staff, and then we could always shoot it to you.
Excellent, thank you. Yeah, a lot of times we do get, we navigate families to different services, and this is a big one that we usually get, and we usually refer to you guys, but it would be good to be able to have a preliminary conversation with some of those families to kind of give them a heads up. Um, that was my only question. Thank you. Anybody else here that's been listening in that has a question for either Josie or Kathy? Feel free to take yourself off mute or write it into the chat box.
Hi, Josie and Kathy. Can you ladies hear me?
Yes.
How are you? I just wanted to know, like if we were going to have a conversation, because there is, you did find out, Kathy, that there's vitamin A, folic acid, and beta carotene. Now, if I was to have a conversation with a community member and say, these edibles are really good to add into your diet because, it's been found out that deficiency such as vitamin A, folic acid, what would you recommend me saying to the community, like simple stuff that add into your diet, this and that and the third?
Well, great question, Angie. Thank you so much. I think just like that, having these conversations, saying that, hey, again, like I said, research is constantly changing, evidence constantly comes out. So that was actually something that I learned, which I thought was pretty cool. So yeah, just starting that, be like, hey, focus on the importance of vitamins, right? We need vitamins, we need supplements, and that can help keep you as healthy as possible, including can possibly decrease your risk of developing cervical cancer, things like that.
What foods do you think would be like if you were to like out of the top of your head, if you said like, I would suggest this edibles added to your grocery list. I don't know,
leafy green vegetables. Usually it's a leafy green vegetables like kale, spinach, things like that. I know that's high in folic acid and vitamin K. So I know that.
Okay, thank you.
Thanks, Angie. Does anybody else have a question? Okay, I don't see anything coming through to the chat box. And again, if anybody has a question, please feel free to take themselves off mute and ask Josie and Kathy.
I just also wanted to say, it's thank you, Jennifer, for hosting this and for the Department of Health to take cervical cancer, it's Cervical Cancer Awareness Month. And I know I have a uterus myself. I know how uncomfortable pap smears can be, but it's definitely something that you can do to kind of take control of your own health and well-being, staying on top of your screening schedules, just making sure, it puts you in the driver's seat as the patient, as the client, and doing your research. So just as much information as you can get, stay well up to date, always bring this, have questions for your provider, tell them, hey, I was researching this. We as providers don't know everything. And so there's constantly stuff changing. So, just take these information and use it in being your own advocate.
I love that. And you brought about a really good point, Kathy, having conversations with your providers and some of the families that we hear through the coalition and many of the partners that are here. We work with families that that may not even have a primary care provider, may not know how to get to a GYN specialist. So being able to help navigate to those services is something that the coalition definitely can help with. So for everyone that's here, if you have a family that you're working with that really would be interested in getting screenings, please connect with us if they are not sure of how to even get started with something like that. Yeah. Okay, if there are no other questions, I'm going to close us out today by just giving a few Ocean Monmouth Health Alliance updates. I'm going to thank Kathy and Josie once again from Planned Parenthood for being with us as our guest speaker today. And again, as I'm talking, if you have a question that comes up, feel free to throw it in the chat box. So this was part of our Health to Hold webinar series. We do this monthly, and our next one will be on February 28th at 10 a.m. Our guest speakers will be the folks over at Cancer Support Community, and that's for National Cancer Prevention Month. So looking forward to that. Another thing that we have happening is on February 5th and February 12th in person at Casa Freehold in collaboration with our friends at Seed. We will be doing a movie night. So it'll be done in 2 parts and it will be all about HPV and cervical cancer. The film is called Someone You Love, and it follows the lives of 5 women who have HPV diagnosis and different outcomes. So it's very interesting and informative film. I've seen it multiple times. And if you have families that are interested in joining, we can certainly share the flyer with you. So that's happening again, February 5th and 12th, 7 to 8:30 p.m. And for folks who join both sessions, we'll be giving out a raffle for a gift card. The third update I wanted to mention is that we have hired a new bilingual community health worker. We share her with the SEED program, and I would like to introduce and welcome Angie Jean Bart. She's with us today. Angie, if you wanted to just take yourself off mute and say a little hello, and we welcome you to our team and to this community of great partners.
Hello, everyone. My name is Angie. Thank you, Jenna. It's been a pleasure. I actually got to know you and Seed at the HPV movie when I brought my kids somewhere. Like I was like, I'm lost in the library, but it was such like it's just full circle because I have friends that had and cousins that were going through that at that moment. And then when the event came up, exactly like a year ago, I think I went with my kids because I didn't know what it was. It was something that was concerning because I had one of my cousins and a friend that I had that had gone through it, and it was so devastating because they didn't know what it was. They thought it was already like cancer. They just didn't know what to make of it. And when I saw the video, it was very like to me, it was emotional because we saw, the ladies portrayed in these videos are like there's good endings and there were very sad, some of them, the one of the ladies, I don't think she made it through, but it was so awakening to understand the realities of what it takes to go through this diagnosis or anything further. So thank you, Jenna, for thinking of me for, to help out with this is rewarding in so many levels. And I appreciate all of you. I love learning. So I was like, okay, Kathy was giving out some info. I was like, all right, taking some notes. So thank you so much, Josie and Kathy and everyone here for collaborating with all of us. I think the community needs people like each of us to kind of become knowledgeable so we can continue empowering people that don't have the opportunity to be as knowledgeable as we all get to be through research and, community and learning. Some people just work too many hours to get this information, and having these events allows people that don't have access to being conscious and aware of what's really out there, allows them to have the resources that they need to make better decisions. It's not out of lack of not knowing. It's really, they just don't, right? Because they don't have that opportunity. So thank you so much, everyone.
Oh, thank you, Andy. That was wonderful. And we welcome you not only to the coalition, but we have a great network that we work with here. You meet people along the way. So folks that have not met Angie yet, here she is. And please reach out to one another and schedule some intro meetings so she can learn about all the work that you do when we are thinking of hosting different events. It'll be great to work together. So that's our Angie update. And then finally, HPV video clips. Our coalition with some of the other regional chronic disease coalitions around the state has come together last year. Well, maybe it was 2 years ago now. I can't remember. But anyway, we created 4 video clips about HPV, about stigmas related to the vaccine, about vaccine access and how to talk to your provider. And so these short little video clips can be used to promote on social media or on loops at doctors' offices and the waiting rooms. They can be used when you're out in the community doing education. Someone just recently reached out to me and told me that they were going to use them for a school project that they're working on. And so we have these clips in English and in Spanish. We're happy to share with folks who have interest, and you can use them however you need or want. And we're just happy to share. We're very proud of the work that we've done to create and promote them. So again, I can put those in the chat, or actually maybe I'll just follow up with an email afterwards. So yes. those are all the updates that I have to share today. And again, I just want to thank you all for being here. And again, thank you to Planned Parenthood, Josie and Kathy, for being our guests today. And I'm going to close us out and just say, have a great day, everybody. Happy Wednesday.